Welcome to the UNM Healthcast. I'm Elizabeth Dwyer, and today we are talking with Dr. Melissa Martinez, who is a professor in the Department of Internal Medicine. And Dr. Martinez is going to speak with us today about the COVID vaccine versus the flu vaccine and discuss a lot of the myths versus facts for both of those things. So welcome, Dr. Martinez. Thanks so much for being here today.
It's my pleasure. Thank you for inviting me.
Yes, of course. So let's just start with talking about the two different vaccines. For a long time, I know that we were told if we needed to get a flu vaccine or a COVID vaccine, we should be spacing those out. But what's the new science around when and how we can get those two different vaccines?
Yeah, there's increasing data that it's safe to give both vaccine together, and we know that it's much more convenient, and people are more likely to get two vaccines if they get them at the same time. So if that opportunity presents itself, we would recommend that people get them both.
That's so great. So no need to space them apart. You can do a 2-for-1 kind of situation, and that's especially important right now as more folks are being guided toward getting a booster shot at this point. Can you talk a little bit about vaccine boosters and who should be getting those or thinking about those right now?
Yeah, so vaccine boosters are a little bit confusing, and there's a recommendation that people age 65 and up get a booster. People with certain medical conditions should get a booster, and people who live in long-term care facilities should absolutely get a booster. There is a permissive recommendation. In other words, people may get a booster if they fall into other categories, such as if they're 18 to 49 with certain medical conditions, if they're in a high-risk situation where they have a lot of potential exposure to COVID, and they're 18 to 64. So that's more of a permissive recommendation, like you can get it if you want it, than a strong recommendation for people age 65 and up, people with conditions and people living in long-term care facilities.
So folks who need a booster or a flu shot, are these things? We're going to have flu clinics, and we can definitely put up some information as part of this podcast where we can direct folks to where to get their flu shots. But if they're in need of a booster, how would folks go about getting that shot at this point?
Getting a COVID vaccine is easier than it ever has been. You can pretty much walk into a pharmacy and ask for the vaccine. People can go to the Department of Health website and register and find vaccines that are available in their area. It's actually a much, much simpler process. Now, for medical healthcare workers and their boosters, my understanding is that the Department of Health website is of October 11th is going to tell people that they qualify for a booster, but not until October 11th. So if you're a healthcare worker with no underlying conditions and your age isn't right, and you try to go to the website, you might get a little bit frustrated.
If there are folks who don't have any vaccines yet, who have been waiting for whatever reason or holding out, and who have maybe had concerns in the past. In particular, I know we talked a little bit before we started here about pregnant folks who might be hesitant because they don't know about the safety. Can we talk a little bit about the data and the evidence that we've collected over the last year plus of, or I guess we are not quite there yet, but the last several months of having actual vaccine data?
Yeah. It's scary. We know that this is a new vaccine, but we also people don't realize is that the COVID vaccine is one of the most thoroughly tested vaccines that we've ever had, that people are monitoring the safety of this vaccine really, really closely. And that includes in pregnant women. And what we know thus far, and the monitoring, the safety studies haven't stopped, they're still ongoing, but we know that women that have received the COVID vaccine don't have any adverse outcomes like spontaneous abortion or miscarriage or preterm delivery, or even problems with their babies going to the intensive care unit. Those rates aren't any higher in women that have received the vaccine versus women that haven't received the vaccine. Now, what is really scary is that pregnant women that get COVID, and pregnant women are more susceptible to the COVID infection, are at least 2 to 3 times as likely to end up in the ICU, to have maternal death, to have babies that are preterm or go to the ICU, and to have fetal demise or fetal death. So on balance, it looks like the vaccine is safer than getting COVID disease. So for somebody that absolutely doesn't want to get the vaccine, we tell them the next best thing that you can do is to really, really socially isolate. Stay away from everybody, wear masks, and just be really careful during this really important time in your life.
So essentially, anyone who's pregnant who doesn't want to get the vaccine should essentially act like they're still on lockdown, like they're still moving through a world in which the, winter of 2020 for the rest of us was.
I mean, yeah, that's the second. I mean, everybody should continue to be careful, no matter what. But yeah, you're right. That's really the second best choice. But
well, it's encouraging to hear that there's been a lot of data that points to how safe and effective the vaccine is, even among pregnant women. And it sounds like, the wait and see folks who have been holding out to get the vaccines now have some evidence and some data to, like, they've waited and now they can see that none of us who've been vaccinated have grown extra limbs or Yeah. So is that something that you feel like you would encourage people to look toward the data who've been waiting and seeing?
Yeah. I think I would encourage people to look to the data. I would encourage people to go to things like to websites like the CDC and look at their data, and to be careful about just looking at information that's randomly pops up on the internet.
Absolutely. The internet is, I've always said, a blessing and a curse, because we are more connected than ever, and that can be so wonderful. And it can also be really tricky to navigate, and sometimes outright dangerous. So we really appreciate you stepping in to dispel some of the myths and facts. Do you feel comfortable? I should have asked you this before we started talking, and if you don't, no pressure at all. But more and more, we've had some issues coming up with the ivermectin treatment. Is that something you feel okay speaking to?
Sure. If somebody gets an infection, whether they've been vaccinated or not vaccinated, we want to take care of them. We want people to have good outcomes no matter what. And I would really, really encourage people to contact their healthcare provider or an emergency room our place if they get an infection, and rely on medical advice regarding treatments. There are a lot of treatments that are out on the internet, like ivermectin, and I won't name all the others, that are really not effective and can be incredibly harmful to people. So please, 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 if you get sick, contact your medical provider.
That's great advice. Thank you. And as we go into another flu season, can we revisit the sort of the trickiness around the similarities in flu symptoms and COVID symptoms, and what folks should do if they're feeling sick regardless?
Yeah, yeah. No, it can be really hard to differentiate between influenza, which causes flu, and the symptoms of COVID-19. They both have very, very similar symptoms, as do other, viruses that cause the common cold. We all get body aches and runny and congestion and runny nose and the low-grade fevers and things like that. And so my advice would be, if you get sick, first of all, quarantine yourself. Don't let your other family members get sick. Second of all, contact your medical provider so that they can recommend testing if necessary. And, we want to get everybody through this. So if you get sick, contact your providers.
Leslie, as a parent, I have a child who's too young to be vaccinated currently. And with more and more information coming out about how that potential clearance for kids is imminent, do you have any thoughts or advice for parents as they consider the option of vaccinating their children under the age of 12? I think between 5 and 12 is what we're looking at next stage.
Yeah, I think we're all waiting anxiously to see the data. But my understanding is that it looks pretty good, that the vaccine will be effective. I think the next stage is 5 to 12-year-olds. So your 2-year-old won't be in that stage. But in the meantime, we can do things to protect ourselves and protect our children. And by getting a COVID vaccine, you are protecting your children by having people at your school be vaccinated and wear masks and things like that. You're protecting your children. So let's stay tuned and let's look at the information carefully once it's presented to the FDA and the CDC regarding the vaccine in younger children. But I think it's coming, and I think it's going to be helpful in getting us past this pandemic.
Absolutely. So thank you so much for talking with us today, Dr. Martinez. Are there any thoughts that you want to leave folks with in terms of vaccines and myths and facts and how to best find our information and guide ourselves toward being safe and healthy in this very unique period we're living in?
Well, that's a lot for me to do in a summary statement. I would say that last year we were incredibly lucky with a really, really low incidence of flu in our community, in fact, nationwide. And I don't think we're going to be as lucky this year. So I would really strongly recommend that everybody get a flu shot. You don't want to get flu and COVID at the same time. You don't want to get flu and end up in the emergency room where there's COVID going around. You'll just be much, much better off if you're protected against influenza.
Awesome. So we're going to go ahead and put up those flu site flyers so folks have information on where they can get their flu shots. So even if you're all caught up and set with your COVID vaccines and not currently in need of a booster, you still want to get your flu shot. I had the flu and strep throat as a child at the same time, so I'm living proof that you can get multiple viruses and illnesses at once, and it is really unpleasant. So I second Dr. Martinez. You don't want to experience any dualities in terms of your illness. So flu shots for everybody. And we have our COVID website that we will put up for folks as well. And you can, of course, also visit the CDC or the New Mexico Department of Health for further information about COVID and the vaccines.
Great.
Thanks so much, Dr. Martinez. We really appreciate your time.
My pleasure. Thank you very much.